So I just want to go through a couple of little self-massage techniques that may help if you tend to have an anterior shoulder posture, so where your shoulders tend to roll forward. Really common with desk workers, due to sort of hunching over the desk all the time, and just our modern lifestyles in general. Also, if you suffer with a lot of tension up your neck, if your shoulders are coming forward all the time, you're putting this area under extra strain. So if you can release at the front and ultimately strengthen the muscles at the back, draw your shoulder blades back, you'll be going somewhere to easing up that tension at the back of the neck there. So the two muscles I want you to consider, I'll just bring my diagram up here. We've got pectoralis minor, so it's quite a deep muscle, and then over the top we have this muscle here, pectoralis major. So in order to do those muscles, the fingers of the opposite hand start up by the shoulder joint and just massage along. Come along the collarbone, all the way across to the sternum, and then go back to the start point and work your way down, so that basically you're covering the whole of this muscle. Now if you find a point that's particularly tight and tender, that's a trigger point. Hold that, and that initial intensity of pain should start to ease up. As it does, just push a little bit deeper, a little bit sharper again. And then one last time, so about 3 times in each of those trigger points. And then continue your journey through that muscle and working down each time in like a triangular motion, starting at the point of the shoulder. So that is your pec muscles. I have got a separate video which shows you how to stretch those out. Now the other muscle I wanted to look at is a muscle called serratus anterior. Just bring my little diagram up. It's a little bit harder to see. So it's this muscle, goes from the back behind the shoulder blade, back behind the shoulder blade, wraps its way round to the front of the rib cage. So it comes like a bunch of bananas almost, or fingers, around from behind the shoulder blade to here. And what it does is when it contracts, it brings the shoulder blade forward. So if you think if you're punching someone, that movement of that shoulder blade going forward is this muscle serratus anterior. And this can be acutely tender to massage. So often I actually get my patients to do this themselves at home because they don't appreciate it when I stick my fingers in there. So to get to that muscle, again, using the fingertips of your other hand, claw the fingers, lift your arm and think about where the seam of a t-shirt would lie. Come fairly high up into the armpit and push in against the rib cage. If you're getting lots of soft tissue and muscle, you're probably too far back onto this muscle. So come more into the armpit and push in against the rib cage. Work your fingers down that line. You can relax the arm down, it helps to make things a bit easier. And imagine like where a lady's bra strap is. If you come down just below the level of where the bra would sit, and also working your fingers forward, and you'll probably find some very, very sore points again. Again, these are trigger points. If you find one, hold it. As it eases, push again, and as it eases, push again. Okay, so that's just a little self-help video on how to tackle 2 of the muscles that tend to draw your shoulders forward.